Hi there and welcome to Asthma Part 2. I know this is very exciting and I really hope genuinely you're excited if you have asthma because we can try to make some meaningful changes in your environment and your life. Rule number 1 of asthma is every single patient, young and old, should have a rescue inhaler just in case you have an asthma attack. Nothing else will help open up your airways as well. Now, let's talk about other strategies before we hit on medicines for asthma. If you have asthma, then you want to look at your environment for possible triggers. Let's go allergies first. So, mold, dust mites, pet dander. If you have asthma, you probably don't need to have a kitty cat farm in your house. Or, whatever you happen to be allergic to. You want to make sure and keep your window dressings to a minimum. If you walk around my house, you'll think, wow, this lady doesn't have any curtains in her house. It's because my house is also full of asthmatic people. And we do not have a kitty cat farm in our house either. So. There's also sheet protectors you can get, pillowcase protectors that help keep dust mites from penetrating into your bedding. You want to make sure and wash your bedding in very hot water at least once a week. Keep everything very clean. Dust regularly, and you probably need to wear an N95 mask while you do that so that you're not just inhaling everything that you're trying to pick up and dispose of. You want to have your vents in your home cleaned pretty regularly because your fans and vents are just going to be blowing allergens at you, which is going to irritate your airways. Also, try and decrease the amount of environmental triggers that you're exposed to, whether that is strong scents or smoke, other environmental things that may impact you that we have control over. We don't have any control over weather changes and the temperature outside, so we try to do the best we can. One of the other frequent triggers for asthma that sometimes goes unaddressed is acid reflux. So if you have heartburn or wake up in the middle of the night coughing, feeling like there's something burning your throat, that may be acid reflux and you may need to talk to your doctor about having that treated. That may take quite a great deal of the burden away. Also, we try to prevent exposure to infections when we can. In the winter months, if that's when you tend to have more asthma problems, avoid huge gatherings where there's likely to be somebody sick who may be trying to pass around some of their germs to other people, unwittingly, of course. Let's give them the benefit of the doubt. I would recommend getting your routine immunizations for pneumonia, RSV, flu, and COVID, and anything else that may be recommended for you. Keep up on that. Keep your immune system healthy, and hopefully we can prevent triggering it that way too. If you need to be on maintenance therapy, meaning preventative medications for your asthma, of course, you'll probably be on some sort of allergy medicine. And while we're talking about allergy medicines, there's a pill called Singulair. The generic is Montelukast. It is a leukotriene receptor antagonist. Leukotrienes are just another mediator of inflammation, similar to histamine, but different. And so some people will have a dramatic impact on their symptoms from taking that pill daily. We can also use long-acting beta agonists. We don't generally use those by themselves, but inhaled steroids are often mixed with those long-acting beta agonists. Things like Symbicort, Dulera, and Advair, for instance, have been around for many years. We can use the inhaled steroids by themselves. There's a stepwise approach to this, and it depends on your severity and also how they make you feel and which ones you tolerate best. For rescue purposes, I mentioned earlier that everyone should have a rescue inhaler on hand. Definitely. There's another rescue inhaler just out not long ago called Air Supra. It is albuterol mixed with a steroid, but not indicated for long-term use. This is only indicated for acute or right when you need it use, which I think is pretty exciting because much of the time what someone needs is to calm down that underlying inflammation along with the airway constriction. So I'm very excited. I've thought for a long time that we needed this, so I nerd out about medicine, so this is very exciting to us science nerds. Also, depending on the severity of your asthma, you may need a nebulizer so that you can have albuterol breathing treatments, potentially Atrovent or ipratropium, and some people will even use steroid nebulizers on a preventative basis instead of a steroid inhaler. You'll come up with that plan with your doctor, but that is another option. How do we know if your asthma is under control? Well, frankly, if you're not having symptoms, then that tells us you're probably doing pretty well. We generally gauge that by how often you have an asthma flare or the rule of twos. If you have daytime symptoms more than 2 times a week, where you need to use your rescue inhaler, if you have nighttime symptoms more than 2 times a month, or if you are refilling your rescue inhaler more than 2 times a year, that means your asthma is not under adequate control and you need to revamp your preventative strategy. I can't emphasize this enough. Air good, not air bad. So, if you feel like your asthma isn't under good control, call your doctor's office and make an appointment so you can come up with a good plan on how to move forward. Thanks for tuning in. Don't forget, like and subscribe. Stay tuned for more.